what happens if you have a little bump or a scab on your nose that just won't go away? Most people don't think twice about it until it starts bleeding again and again. So today's video is about why the nose, of all places, is one of the trickiest and most common areas for skin cancer. But first, welcome back. I'm Dr. Maria Azizian, a board-certified general surgeon and an IFM-certified functional medicine physician. On this channel, I share health tips on skin health, food and supplements, functional medicine, surgery, and the latest medical research to help you feel your best. And if that sounds good, please like, share with your friends, and subscribe. First, let's answer the question, why the nose gets skin cancer so often? Well, the nose is front and center, literally. It catches the most sun exposure of almost any spot on your body. So that UV damage adds up over time, especially if you've had sunburns as a child or never wore sunscreen regularly. The most frequent type of cancer here is basal cell carcinoma, which grows slowly but can be locally destructive. We also occasionally see squamous cell carcinomas or even melanomas, but basal cells are the usual suspects on the nose. With basal cell carcinoma, the onset is often, not always, gradual. You may not even notice anything alarming at first, just a shiny bump or a sore that crusts and heals, comes and goes, or a tiny patch like a reddish-whitish skin. Unfortunately, by the time it catches your attention, the cancer may have already invaded deeper layers. The good news about skin basal cell cancer is that it rarely spreads to lymph nodes or other organs. The bad news is that if it is left unattended, it does grow in widths and depths. So what is the next step? Let's say I noticed a suspicious spot on the nose during a skin check, or if a patient comes with that specifically. The next step is skin biopsy, and it could be a shave or a punch biopsy when a small sample is sent to pathology to identify what we're dealing with. And I have to say that these suspicious spots on the nose, they're very common in clinical practice, and I perform these biopsies all the time. Very, very common. If pathology comes back benign, let's say it shows precancerous lesion that's still benign, or even better, a benign sebaceous hyperplasia mimicking basal cell carcinoma, then we don't need to do any other surgical interventions to this area. I actually have a video about sebaceous hyperplasia that I will link here. Now let's look at the scenario when the pathology shows basal cell carcinoma. Then the next step is planning treatment, and that's where things get complex. The nose isn't like other parts of the body. You can't just cut out the wide margin and call it a day. So why treating the nose is so challenging? And here's what makes it tricky. The skin on the nose is thin, and underneath there's mostly cartilage with very little extra tissue to work with. So there's literally not much wiggle room surgically. That means if we remove even a small tumor, we might be left with a hole or defect that's too big to close with just a few stitches. And the nose isn't just cosmetic because it plays a role in breathing, smell, and even how we sound and how we speak. So preserving both the form and function is critical. To maximize this precision, we often turn to Mohs surgery, a highly specialized technique where cancer is removed layer by layer, checking each layer under microscope while the patient waits in real time. The goal? To remove all the cancer and only cancer. This is especially important, yes, on the nose, because we want to preserve as much normal tissue as possible. Every millimeter counts. Now, once the cancer is gone, you're left with a wound, and sometimes it's quite large. In that case, often a plastic surgeon needs to get involved. And I often get asked this question as to what is the difference between skin graft and skin flap. A graft involves taking skin from another part of the body, usually behind the ear or from the clavicle area, to patch the wound. A flap means using nearby tissue that's still connected to the blood supply to cover the wound. And both are very planned procedures that need to balance the cosmetic outcome with structural functionality because we want the patient to function normally and be confident in their appearance. So what can you do? First, of course, is prevention. On this channel, we talk a lot about using sunscreen with SPF at least 30 to the face daily, all year round, even indoors. and I'm linking my recent video about that here. However, once you are diagnosed with basal cell carcinoma, you can't really undo that. So the good news is that basal cell carcinomas are very treatable, especially when caught early. So if you notice a spot on your nose that is not healing, don't wait. It may seem harmless, but on the nose, even small cancers can become a big problem if ignored. I hope you enjoyed this video. Please like, share, and subscribe for more videos on skin health and other fascinating medical topics. Thank you so much for watching. Until next time, bye-bye.